Good morning, students. So continuation of DOTS treatment regimen. So few more slides are left regarding DOTS regimen under RNTCP. So till last class we have seen about different aspect regarding the how many weeks intensive phase and how many weeks continuation phase in category 1. In category 2 also we have seen about 3 months the patient has to be on intensive phase and 5 months in continuation phase, followed by these medicines dosage. So dose of essential first line anti-TB drugs under daily regimen. So this is the dosage. So isoniazid, it is 5 mg per kg, that is 4 to 6 mg per kg daily. So accordingly, based on the weight of the patient per kg, 5 mg per kg, in that way it is being calculated. Rifampicin 10 mg per kg, pyrazinamide 25 mg per kg, streptomycin 15 mg per kg, ethambutol 15 mg per kg. So this is the minimum dose of the medicine per kg, and accordingly as per the weight band it is being calculated, and accordingly fixed dose regimen is being provided. Combination drugs are being provided. PWB, that is patient wise box. So, as practiced for intermittent regimen, RNTCP has obtained the concept of one patient, one box for daily regimen also. So, I have shown you a picture. Are you remembering? In a red box, yellow box, blue box. So, this is a box. Okay. So, each patient one box. So, this is a patient in category 1, that is new cases, and his weight band is 25 to 39 kg. So, you can see here in this strip for 28 tablets are the daily one the patient has to take. So in that way a patient wise box is being kept in the along with the DOTS provider. The daily regimen patient wise box consists of blister packets of schedule 9 for intensive phase, schedule 10 for continuation phase. So accordingly the medicines in intermittent, in old regimen also we do have this patient wise box. For here also we have this kind of box is being maintained, and the strips are being kept in that month wise the patient can be on medications, and accordingly for the intensive phase and continuation phase. So, wherever appropriate, a family member can be assigned with the responsibility for observing the treatment. It's not compulsory that a DOTS provider must be a medical personnel. Even the family member who is responsible in taking care of the patient, who is scheduled to give the medicines on correct time without skipping any days. If the patient is responsible and obliged to the patient's medication treatment, then the family member itself can be the DOTS provider. Situations especially like sick and bedridden patients, children, long day workers, etc. So in that cases we are asking family member to be the DOTS provider. Otherwise the patient hand can come to the nearby sub-center or Anganwadi to get the medicines to take in front of the DOTS provider. But in these cases it is being exemption. In these cases the family member can itself be a provider, and in front of the family member the patient can take the medicines. In such situations the family member should be trained well and under strict supervision. So in between the healthcare workers can will be visiting this family and checking whether the DOTS provided is correctly providing the medicines or not. Long-term follow-up. After the completion of treatment, the patient should be followed at the end of 6th, 12th, 18th and 24 months. So this is the time period in which the checkups are being done for virulence of this bacteria. In presence of any clinical symptoms or cough or sputum, microscopic culture should be considered. This is important in detecting recurrence of TB at the earliest. So in between, during the time of medications, it is being checked whether the symptoms are being resolved or patient is being recovered, or any complications are coming or not. So all these are being cross checked. Not CBNAT, we don't know how long the dead bacilli exist. So we are using the CBNAT as an advanced technology to check the DOTS patient's consistency. Otherwise also this through these checkups the long-term follow-up is being done to identify the presence of TB treatment for the patient. Okay, thank you.